the endovascular stent grafting in the infected aortic aneurysm. This is a series of endovascular repair in our hospital. Usually we perform around 40 cases a year, and 8% of the stent graft is in the myocardial aneurysm. So we like to study our outcome in the endovascular aortic repair in the infected thoracic aneurysm. We review the data from September 2006 until May 2012, and 15 cases of the infected thoracic aneurysm was performed by TIVA technique. We have 11 patients in male, and average age is 66 years old. The age range is from 30 to 82 years old. 60% of the patients have a positive blood culture, and majority of them are Salmonella group D. Some have Staph aureus and Streptococcus, and one with the Burkholderia cephalosia. The pathology of the aortic aneurysm is majority in the descending aorta in 13 patients, and one in the distal aortic arch, and one include the abdominal aorta. We have to do the associated bypass to the all branch of the aortic arch in one patient, and also we have to do the debranching at the celiac and SMA in one patient. The stent that we use, a majority of them are variant from Medtronic, and 3 from Gore-Tex, and 1 from Zenith Cook. The average operative time is 116 minutes, and average hospital stay is 18 days, because we have to give the patient antibiotics. We follow the patient with the CTA, white blood count, ESR, and CRP. The follow-up time in our studies means 26 months. This is a series of our patients. So the maximum size of the aneurysm is 11 centimeters. Hospital mortality is only 1 patient from 15 patients. And after follow-up at 1 year, we found that 5 of the patients die, and all of them die from unknown or aneurysm-related death. Maximum follow-up is 58 months. For the organism, in our series, we found that the Salmonella infection had a bad outcome. We have 2 patients die in this group, and 2 patients need conversion. And now, still 1 patient survived from Salmonella infection. In the non-Salmonella group, we found that 6 patients still survive with a good outcome of the follow-up. We follow up the CRP level and found that its level is decreasing, and also the white blood count and the ESR. We use all of these to monitor the antibiotics that how long should we give the patient. This is an example of the patient with a 66-year-old female with staph infection, and from the CT scan at 3 years and 4 years show a good aortic remodeling. And another patient with 75 years old at the aneurysm at the lower descending aorta, and we follow the CT scan up to 2 years and show good outcome. Another lady, 73 years old, with strep infection at the lower thoracic aorta. We put the stent in, and then we follow up to 3 years and also show a good outcome. Another gentleman, 72 years old, with Salmonella group D. We do the total arch bypass and then put the stent in. And from 2 years follow-up, he's still okay. This patient, he had hemoptysis after operation at 2 years and found that there's the distal dissection, so we have to put the stent below the previous one, and still okay. The other patient, which is very interesting, he had the stent done almost 5 years ago, and from the 4th year's follow-up, is still okay, and he presents with hemoptysis. From the CT scan, we cannot identify any endoleak, and then from the bronchoscopy, it still shows some blood in the left main bronchus. Aortography done without any leakage. Anyway, finally, we decide to operate this patient from the left thoracotomy, and we found that the infected aorta, and then we saw the graft. So finally, we have to remove the graft and replace the graft and wrap with the pleura. So for the midterm outcome in our series, the 15 patients, 14 patients survived and discharged from the hospital. And after follow-up, 5 patients dead without non-related or non-aneurysm related cause, and 9 patients still survive, and 2 of them need conversion, and both conversion is from salmonella infection. 3 patients need the retriever because of some had the new dissection at the distal end. From other study from New Zealand database, the report 4 cases of the infected aneurysm treat with TIVA. They have a mean survival for 486 days. And another big series from our colleagues from southern of Thailand, they report 21 patients with the infected aneurysm and show that the fistula group have a higher mortality, and the non-fistula group show very low mortality in only 6% by follow up to 22 months. So, ladies and gentlemen, I would like to conclude that the midterm outcome of the TIVA in infected thoracic aneurysm is acceptable, and salmonella infection had unfavorable outcome. It may be an alternative treatment in high-risk patients. However, the long-term monitoring is still mandatory. Thank you very much for your attention.
Thanks very much, Dr. Worawong. Just a question, when you have these kind of infected aneurysms, how long do you continue the parenteral antibiotic therapy? For how long do you give
we give them at least 6 months, and then we follow the white cow, ESR, and CRP.
6 months of IV antibiotics?
Actually 6 weeks for the IV. And then if the fever is down, and then we give him the oral antibiotics, at least 6 months, and then we follow the white cow and the CRP. Yeah.
Right. Thanks very much.
Any further questions?
Any other questions from the audience?
Can we move on to the next presentation? Okay. Thank you very much, Dr. Worawong from Thailand. And